who have been attending the classes up until this point, I'm hoping that things are beginning to get a little bit clear about what I'm trying to do here. A couple of things. First, I'm obviously trying to share a whole lot of information with you so that you can improve your knowledge base, so that you can feel like you're getting up out of the chair here and doing a better job with your own diabetes patients. But the second thing that I'm really trying to do is I'm trying to give you this information in such a way that it's allowing you to see some of the skills or some of the ways that you can transfer the information over to the patient so that actually you're turning them into an empowered self-manager. Hopefully up until this point, most of the sessions that you've been sitting in, I hope that you have gained a fair amount of knowledge to improve your own knowledge base. But what's going to happen today is I think there's going to be a little bit of a more emphasis on the other aspect. I think that much of the information I'm going to give you today, you probably already have a jolly good base knowledge of it. What I'm going to share with you is how do I bring the patient on board? How do I bring them up to speed with my knowledge level? Okay? So for the first 30 minutes, what we're going to be doing is focusing on foods, in particular how do foods affect blood sugars when a person eats them. And for the second 30 minutes, we're going to switch over to the slideshow and we'll take a look at how do you manage cardiovascular risk. I think that probably, as I've alluded to, most of us in this room are probably very comfortable with talking about foods with people who've got diabetes. I think that we all have a very clear idea about what we think they should not be eating, and we have a very clear idea about what we think they should be eating or what they should be putting on their shopping list. And what I thought I would do to start with is have a little bit of a fun and find out what is on your list, let's say on the list of what a person should not be eating. In other words, the bad foods that they shouldn't be having. Anybody want to give me any suggestions? Pardon? White rice. Anything else? Potatoes. Anything else? Donuts. And donuts really are, you know, high sugar, right, and flour is what you're suggesting, right? Okay. And soda, which is really sugar. Fruit juice, put that in the same category. Any restaurants they shouldn't be going to? McDonald's always ends up on the list, right? Anything else? In New Zealand, we would be saying fish and chips. That's our fast food equivalent. Or meat pies is the other one, which everybody eats for breakfast, okay? Anything else? Bread? Pizza. What would you be putting in their shopping cart? What kind of things would you be telling them that it is okay to have, to include in their diet? Vegetables. Beans. You mean like pulse beans, kidney beans, chickpeas? Meats. Do any of you treat patients? Fish. Okay. Salads, which I suppose are vegetables. Salad dressings. Low fat. That's how they spell it as well. Or the light foods. Right? The unfortunate way of doing this, and the reason why I've moved away from presenting foods like this to people who've got diabetes, is two reasons. One is that I feel quite strongly that it gives them this idea that there are bad foods and good foods. And we end up with people, I think any of us who've been on a diet also get the sense that there are bad foods and good foods, which puts a real value judgment on yourself when you're eating. And I think that invariably we end up with people who've got diabetes who feel naughty, guilty, I'm a bad diabetic. I think it's incredibly unfortunate that we lay such value judgments on them. I think that for all of us in the room who don't have diabetes, of course when we go to that special occasion, we would like to have cake and ice cream at the end of the meal and not feel guilty when we eat it. And what I'd like to do in the next 20 minutes or so is present to you how I show them about how to think about foods so that they can have that cake and ice cream on those occasions and not walk away feeling like they've been a bad diabetic or a naughty person, or they feel guilty about the fact that they put food in their mouth. The second thing is this doesn't actually provide them with any way of actually thinking constructively about how they want to manage their foods. If you think about it, you've put some vegetables on this side and some on that side, okay? If you think about it, you've put McDonald's here, which has got meat, but you've put meat on that side, so it can actually give them an incredibly confusing picture. And I think that it's much more important to give them appropriate information. So, what I do is I go, you know, when we talk about foods, we have divided them into 3 different categories: carbohydrates, proteins, and fats. I think that most of them, amazingly, this is the one area where most of them, when I've got them sitting in front of me, go, yeah, they know that. They actually have a pretty darn good idea. I then go through the list of carbohydrates, about carbohydrates, proteins, and fats, because after all, I would like to get on the same page as them. I'd like to understand where they are, or as you'll understand when we go through the patient-centered care, I'm trying to find a common language, okay? And so let's go through that process. If I were to ask you to list what you believed were carbohydrates, what sort of things would you tell me? Pasta. And so the thing with pasta is actually flour, okay? So flour is a carbohydrate, and with that we get our bread, we get our pasta, we get our cookies, we get our cake, we get anything that has got flour in it. What's another category that you would put? How about potatoes? Okay? And with potatoes, I list all the other kind of root vegetables that have a high carbohydrate content. Sweet potato, you've got parsnip, you've probably got pumpkin. I have to switch to America. We have taro, we have kumara, which are sweet potato, different kinds of sweet potatoes. Another category would be grains, all right? And with grains, of course, flour is a grain, but for some reason we stick it in a different category on its own. But the other grains would be, of course, all your breakfast cereals. And we've got rice, which is a grain. Other categories? A biggie? Sugar. Okay? With that, you've got your jellies, you've got your honey, your sodas really would fit under that, your juices, high sugar content, right? Another category would be what I call your pulses, or as were brought up before, your kidney beans, your chickpeas, baked beans.
Technically, in the reporting where this statement from, this is some people point about that. But we can say we're talking 30, and then we can switch over to the other way.
Okay.
Do you have that PowerPoint on this set up while you're in the
Well, John Harvey has set it up already. Yeah. Okay. So essentially 5 big categories in the carbohydrate area, right? There are also 2 fruits that have fairly high carbohydrate. One would be banana, and the other is avocado. And there are 2 vegetables that have pretty high carbohydrate content: corn and peas. And that's kind of it. It summarizes pretty well. We're not talking about fresh fruit. And truthfully, what we're talking about here is for people who've got type 2 diabetes. We're not focusing on somebody who's trying to carbohydrate count. We're trying to give them a general idea. And to be honest with you, most people who've got diabetes are able to give me most of those. What about if we were asking them to list what the proteins were? What sort of things would we include in this list? Fish. Did I hear somebody say eggs? Meats, all meats. So you've got your lamb and your beef and your veal and any kind of meat, your chicken, okay? What about dairy products, such as your cheese? And technically your yogurt. Although truthfully, if you're having a flavored yogurt, they add all sorts of sugar to it in order to make it taste good, all right? We've then got the vegetarian proteins, which of course is tofu or soy. And then there are lots of nuts, actually, that are pretty high in protein. So your peanut butter is a protein, except perhaps in the United States where they've added sugar to every jar of peanut butter, unfortunately. Any questions about meats? About proteins, excuse me. And the third category, of course, is fats. We've got our oils, our fish oil, our vegetable oil, all the things that we put in our salad dressings. Okay? We've got our animal fats, which I call lard or drippings. We've got our dairy fats, which we think of as being our butter, okay? Or we've got the equivalent of that, which we've turned into margarine. And of course, we would probably, most of us, put our cream down here as well. All right, so proteins, carbohydrates, proteins, and fats. So here is the trick question that I throw to the patient. Which one of these columns, or is it all of them, are going to raise your blood sugar if you eat them? Is it going to be just the carbohydrates? Is it going to be the carbohydrates and the proteins? Or maybe it's going to be the carbohydrates and the fats. Maybe it's not going to be the carbohydrates at all. Maybe it's just the fats and the protein. Maybe it's all of them. Which one do you think it is? And so I ask you, how many in the room think it is just the carbohydrates that are going to raise your blood sugars? How many of you think it's the carbohydrates and the fats that are going to raise your blood sugars when you eat them? Few takers. How many people think that it's all of them that you eat that are going to raise your blood sugars? You're wrong. Okay? In fact, none of you were right. This is the only category of foods that when you eat them is going to raise your blood sugar. The person usually goes, well, why the heck did they tell me to cut down on my fats when I got diabetes? And you go, oh, well, that's because they were thinking about your cholesterol and your obesity. But we're not talking about those today. We're talking about your diabetes. And it is this column of foods that affects your blood sugar. Now, don't get me wrong, the other two do affect blood sugars, but they do something a little bit different. And I'd like to just go through a couple of scenarios to point that out to you. Let's just say, this is exactly how I presented to the patient, let's just say that you woke up this morning and what you ate was 2 slices of toast. Pure carbohydrate. You didn't put anything on your toast. What does that do to your blood sugars? I've got blood sugar up here, or blood glucose, and you eat the toast here, it's carbohydrate, it makes your sugars go up. Because it's pure carbohydrate, your sugars are going to go up pretty steeply. They peak, and you digest it pretty quickly, and so your sugars begin to drop pretty quickly. Here's a little bit of a tail, but it's about 1.5 to 2 hours for you to drop back to your baseline blood sugar. And I'm not just talking about somebody who's got diabetes, I'm talking about anybody actually. All right? Let's say the next morning you wake up and you have the same 2 slices of toast, so you're having the same number of grams of carbohydrate, but this time you add a bunch of eggs. So you've now added some protein to your toast. Your blood sugars are still going to go up because you've got carbohydrate on board. But now they don't go up nearly so quickly. They actually don't peak so high. They take a little longer to come down. It's about 3 to 4 hours. You had exactly the same carbohydrate. The next morning, on the 3rd morning, you wake up and you go, okay, well, that eggs and toast was a little bit better. But this morning, I'm now going to have the same 2 slices of toast, so exactly the same grams of carbohydrate. I'm going to add the eggs to it, so I put my protein. And now I'm going to put slathers of butter on my toast. So now you've got some carbohydrate and protein and fat in your meal. What happens to your blood sugars? They still go up because you've got carbohydrate on board. However, they go up even more slowly. They don't peak nearly so high, and they take a whole lot longer to come down. Which one do you think is the best thing for a person with diabetes who's worrying about their after-meal blood sugars? Which is the best one for them to have? The moral of the story is that when you eat, you presumably should be combining a little bit from each category in your meals. Take the scenario of you go to a party and there's a buffet, all this absolutely wonderfully gorgeous food sitting out there. Most people with diabetes kind of stand there and go, oh, I really shouldn't eat anything, it's going to be really bad for me, and then slowly sneak over to the table and maybe grab a few crackers, all right? Ooh, they would be better off picking up the crackers and dipping them in the dip. They would be better off putting some chunks of cheese on their crackers. They would be better off reaching for the meats, okay? They'd be better off reaching for the meats and the cheese than they would be reaching for the fruits if they were thinking about their blood sugars. I'm not talking about cholesterol. I'm talking about diabetes, okay? And in fact, if you think about it, what's good in diabetes is not necessarily good in cholesterol, and it's not necessarily good in protecting you from colon cancer. And so our value statements of good and bad foods is very variable depending on what you're thinking about in health. And that's why I think when we put those categories of good and bad foods, we end up providing them with a very confusing picture. Think about your McDonald's meal. Let's leave the milkshake off a little bit, and let's leave the ice cream off at the end, or whatever that white stuff is that they get at the end of the meal, okay? A hamburger and fries. What has it got in it? It's got its meat. It's got a bun. It's got some chips with an awful lot of fat. What a perfect meal. And you know what? If you hand your patients a blood glucose meter and say, hey, go out there and have some fun, guess what they'll find if they eat that McDonald's meal? They will find that their blood sugars, if they check it half an hour after the meal, haven't gone very high at all. Okay? Let them experiment. Tell them, you know what, if you're going to have a sandwich, why don't you have a peanut butter sandwich? Don't have a banana sandwich. So they can begin to understand how to mix and match their foods so that they can actually prevent their sugars from spiking high after they're eating. You know, in New Zealand, our classic meal on a Sunday is to have a roast lamb or a roast beef. And in that roast meal that we have every Sunday, we have our roast meat, and then usually with it, the classic, if you ever go to New Zealand, this is what you'll be given: mashed potato, roast kumara, which is a sweet potato, roast parsnip, roast pumpkin, and then be damned if they won't add peas. What my mother should have been doing, there's nothing wrong with those foods. They're all healthy and good foods. What my mother should have been doing was on some days taking a couple of these and then adding what I call in the freebie column the cabbage, the carrots, the broccoli, all those things that aren't going to be raising our blood sugar. Does that make sense? Okay, it makes sense. So the person is going out with their family on a Saturday to the beach, and what do we do on a Saturday afternoon? We all pile into what we call the dairy, and we're going to buy an ice cream. The person who's got the diabetes happens to look up at the board and they see that they also offer frozen yogurt. So they sit there and they go, oh, isn't frozen yogurt supposed to be better for me than ice cream? And the question is, if they're thinking about their blood sugars, which one should they be opting for? The ice cream, because it's got, especially in New Zealand, full fat in it. If they're thinking about those blood sugars, then obviously they're not going to order it with an ice cream cone. They're going to order it in a dish. Okay, can you see how they can begin to make decisions? It's okay to have that scoop of ice cream, especially okay to have that scoop of ice cream and a piece of cake after a meal if I leave the potato off of my plate. They can begin to mix and match and manage their foods much better. It works really well. I can't encourage you to do it enough. Hand them a glucose meter. We have loaner meters in our office for those people who are just on oral medications and don't need a meter at home. They can go home and they can start to experiment. What about pizza? Somebody said pizza. Let's go back to this list that you all wrote. Pizza. It's got a lot of fat on it. It's got protein. It's got carbohydrate. In fact, you'll find if somebody eats a piece of pizza, their sugars don't go very high. They might stay quite high. They'll stay a little bit high for a long period of time, but they don't do those big spikes after a meal, okay? Absolutely with pure sugars. However, if they had a soda and they were then having it with some kind of meat, pepperoni or something like that, you may find that their sugars won't go as high. So they can make decisions and choices about how they're mixing and matching their foods. Are there any questions about any of that? Many of the people that we see also want to lose weight. We also think that they might want to lose weight. And one of the options that I offer them is I go, you know, if you happen to minimize your carbohydrate content to less than 35 grams per meal, then you will lose weight. And so we start looking at some food labels. For most of us, if we ate 50 grams per meal of carbohydrate, we would maintain our weight. This week I was working in the hospital and I decided to ask the head nutritionist, so how many grams of carbohydrate are in a diabetic cardiac diet when we order it up on the floor? I was blown away. It's 60 grams for breakfast and lunch and 80 grams for dinner. So no wonder our people, even on a diabetic cardiac diet, aren't losing weight. This is about what you need, and it's very simple. A slice of bread is only about 12 or 14 grams of carbohydrate. So you can imagine you can have a fairly large sandwich with 2 slices of bread, all the protein and all the fats that you would like in the middle of it that help sustain you for a long period of time. And in fact, we now believe that one of the problems and why we have all of this obesity is because we have such a high carbohydrate diet. We have spent so long emphasizing the need to get the fats out of our diet. And unfortunately, what people have done is by removing the fats, they have gone and stuck carbohydrates in their diet. Even the foods that are manufactured that are so-called light foods or low-fat foods, as you know, you and I know, when they take the fat out, they don't taste very good. So what do they do to make them taste better? They stick carbohydrates in them or sugars into them. Next time you're at the supermarket, pick up your full-fat yogurt and compare it with the light version of the same brand. And I think that more often than not, you will find that there are more grams of carbohydrate in the light version of the yogurt than there are actually in the full-fat version of the yogurt. The light version is going to push their sugars up higher. All right? Lots of interesting stuff to think about. The message here is please give your patients the information around foods. Don't give them a set of what's good and what's bad. Run with it, have some fun with it, and see what you think. Thanks very much.